Hi everyone, Dr. Lloyd Stegemann from Corpus Christi, Texas and the Better Way Center. How do I know if I'm losing too much weight after my bariatric operation? Well, I would tell you it's very unusual to see patients lose too much weight after their bariatric operation. It seems the body knows where it wants to take you and then it stops. And so the weight loss initially is very fast and then it will tend to plateau over a period of time and patients will level out at that area. Depending on where you started with your BMI before surgery, oftentimes will determine how long it takes you to get to that area where you're going to settle out. For those that are at lower BMIs, say BMI of 35, they're going to get there to that good healthy weight a little bit faster than somebody who's BMI of 55. What's the appropriate rate of weight loss? So with the gastric sleeve in general, we expect people to lose around 3 to 5 pounds a week for that first 3 months after surgery. For gastric bypass patients, that tends to be 5 to 7 pounds a week on average for that first 3 months. And then whatever weight you've gotten to or how much weight you've lost over that 3-month period generally will double by the time you're out. So if you've lost 30 pounds in the first 3 months, we would expect you to lose around another 30 pounds over the next 9 months. And then it will settle out. So sometimes it'll feel like I'm losing too fast or too much, but that's in the first 3 months. I've lost 30 pounds. Now it's going to be 9 months before that you lose the other 30 pounds. And generally, if somebody is losing too much weight, something is going on. They're either have some sort of issue where they're throwing up on a regular basis, or they're not tolerating their foods well, so they're afraid to eat or don't want to eat. We can occasionally see issues where patients are so afraid of regaining weight that they don't want to eat at all. So generally, there's something that's happening that's causing someone to truly lose too much weight. If they are, that's definitely not the norm. And so I encourage you, if you feel like you're losing too much, certainly talk to your surgeon and they can calculate where you should be. They can look at your nutrition numbers and make sure that all of those things look good as well. Last thing on this point is that I oftentimes will let patients get a little lower than where I'd really like them, because starting into year 2, it is pretty well expected that patients are going to regain about 10% of the weight they lost during that first year. So if they lost 100 pounds the first year, starting into year 2, I'm going to expect them to gain about 10 pounds altogether, and then that's where they're going to settle out. And so if they're a little lower than where I'd really like them, I generally do not try to stop it, because I know it's going to bounce back up into year 2. If you enjoyed that video, I encourage you to come back, subscribe, and learn from some of the other experts.